of months where we've had to put that on hold. So I'm Jacqueline Summers, and I'd like to welcome you all. And I want to say to you that I hope that you're all doing well and that you're safe. Today, we're welcoming Gil Addo with RubiconMD, and his presentation could not be more timely. Gil, we have about 30 minutes, and what we'd like to do is maybe hear from you both about your healthcare technology, but about your entrepreneurial journey as well. So maybe tell us a little bit about how you got started and how you're doing as a healthcare startup, and maybe any kind of ideas that you would have, any inspiration that you would have for other healthcare startups. And then we'll leave the last 5 to 7 minutes for questions. Does that sound good to you?
That sounds perfect. Is my audio fine? Can you guys hear me just fine?
Your audio is great.
Okay. I'm going to project here. Can you guys, do you still see this slide? Excellent. Well, first of all, a thank you to everybody for joining to learn a little bit more amidst these very difficult times. And a thank you to the Health Tie team for giving us the platform and the opportunity to share a little bit more about what we're working on with RubiconMD. So as mentioned, my name is Gil Addo, one of the co-founders and CEO of RubiconMD. I'll start with a little bit on myself. Just by way of professional background, I trained as a biomedical engineer, did an MBA, and then transitioned to work in the business side of things as a healthcare consultant for a handful of years before starting RubiconMD. As it relates to what we're doing here, a lot of what we're built at RubiconMD was inspired by personal experience. So we're a 6.5-year-old digital health company on a mission to democratize medical expertise to make sure patients get the access to the care they need when they need it. And this was inspired by a lot of my own personal experience. Growing up, I had a grandmother based in Barbados. She developed a brain tumor, and she traveled to Boston for surgery. And then she spent 5 years going back and forth on all the management and treatment of the tumor. So I was particularly passionate about and inspired to build something that bridged that gap where the key expertise sat and where the people that need it lived across the country. And you can see here in the bottom left, this is a photo from the first surgery she had in Boston. That's me on the bottom right in early 90s style. But you can really understand that part of the challenge here is that the expertise only sits in these few pockets across the country, and the people that need it are in communities elsewhere across the country. So what we built is really simple. It's an eConsult service that helps connect primary care clinicians to specialists for insights. So their text-based opinions will share a little bit more about how they work. So the current situation today that we see in healthcare that we think we're helping to address, almost $1 trillion in care costs every year are avoidable. And then 1 in 4 patients lacks easy access to specialty care. I appreciate the introduction saying that, we are particularly timely right now. I think that, it's really important for people to move right now to virtual care, but I think you guys in Alaska have been at this and are better at it than really anybody, because you guys have had to do this better. So I think it's a timely moment, and people are across the country are having to do more virtually. But I think given the just the nature and the way in which Alaska is distributed, you guys have had to already adapt and do the things that now the rest of the country and the world is having to look at and do. And then U.S. care quality lags all other developed nations. So we spend more to receive less. by an outsized margin. So how we can help. So we actually are a platform that helps, we believe, avoid unnecessary services. We help to expand access to specialty care, and we help to improve care quality. Any questions before I continue? So for us here, the process is really addressing the core referral process. And so what we're actually looking at is typically people, if they were to need to engage a specialist, they would do a traditional referral. We looked at one of our client organizations, and we just went and matched the process that they took for referrals. And then we quantified what it looked like. And we found that there were 8 steps involved. We found that you had to touch 8 different individuals. We found that it took about 5 weeks to schedule. And then we found that after all of that, 20 to 50% of referrals were successfully completed. So that means that more than half the referrals ended up in no-shows. So what we built is really simple. Patients go to see their primary care clinician. If there's some issue that's outside of their expertise, typically that results in a referral. What we allow them to do is go to our web-based portal, upload anything that might be relevant, and just ask a question. We figure out who the right specialist is. We have a network across the country, and we share it with them, and they provide an opinion back in a few hours. That opinion comes back to the primary care clinician, and they use it to follow up with the patient. And we think about primary care as just being whoever is that first responder that's with the patient, but it is a clinical interaction. So we thought we'd share a sample case just to help illustrate it. So Stacy here is a 34-year-old female. She presents with a chronic skin lesion. Her PCP mentions her past treatments. I'm not a clinician, so I'm not going to try and butcher what these are. But she shares a picture of the rash, and she sends it off to the RubiconMD platform. Within an hour, the specialist has responded, and they suggest that a topical antifungal does not provide complete cure. And sorry, I should mention the question is, what differential diagnosis and recommendation would you have for next steps? This is a fairly common type of question that we receive. Derm is about 15 to 20% of our volume. And the dermatologist here is able to weigh in very quickly and suggest a biopsy, 3 to 4 millimeter punch biopsy, and send the tissue, including the stains, for infectious disease organisms. Now, what did this do? This provided the PCP with thoughts on a differential diagnosis. It gives them advice on next steps, and allows them to learn from the explanations behind these recommendations. This is meant to be an educational service. It's meant to help empower the primary care clinician who's seeing the patient. And then obviously for a situation like this, you don't need to send the patient to see a dermatologist. So what have we seen through our platform? We found that almost 80% of the cases through our platform were educational. We found that 75% or 74% of the cases improved the care plan. So whatever was submitted by the primary care clinician, the response back actually helped to improve the care plan for that patient. And we found that we've avoided 2.4 million patient wait days. And the way we quantify that is we look at what it takes in that geography to get in to see that type of specialty typically. And when we're able to avoid those referrals, we quantify the number of wait days that we avoided for that patient. And we've aggregated that. I imagine if we were to add this in regions like Alaska, we'd see, or regions within Alaska, we'd see much greater impact even. And then across our platform, our eConsults have had a 4.86 rating out of 5 stars. And that is a rating by the primary care clinician on the quality of the consult provided by the specialist. And then I mentioned the avoidance of services. We found that 57% of our eConsults avoid services. So they avoid the need to go see a specialist, they avoid diagnostics, they avoid unnecessary procedures. They allow the patient to be managed in the community without having to be sent elsewhere or transported. And we found that this has led to a $300 to $800 savings per eConsult. And that wide delta depends on the cost tied to that geography. So the costs in California for Medicaid population are very different than the costs in Alaska for a commercial population. And so we look at those deltas, and that helps us to average for that given population. Some fast facts about our eConsult program. We found that 1 in 5 eConsults are responded to within an hour. And so we've been able to push the response time down significantly from what it would take to get access to the specialty expertise. We cover 120 specialties and subspecialties. I think it's actually today more like 130. So we're able to provide access to a very, very broad range of specialists. We have a median turnaround time of 3 hours. So the average consult gets a response within 3 hours. And you can take that and you can compare it to 3 weeks in some areas to get to a specialist, or 3 months in other situations. And 100% of our specialists are US-based board certified specialists. We guarantee 1 business day turnaround time. And then clinicians who use our tool can receive CME credit, continuing medical education, half a credit up to 20 credits per year. So we had an accrediting authority that was able to provide this for us. And it took a significant amount of time, but that's accreditation through the AAFP for physicians, as well as nurse practitioners and physician's assistants. And so obviously it's quite timely here, and we are seeing quite an influx in terms of interest in how we can support. I thought it'd be helpful to just share out how we do help. So we've put together for our clients basically a flow that allows for alleviation of resource need within a hospital. So can you take things that had to go to a hospital and move them out into the home, out into clinics, and out virtually as much as possible? And so groups have enabled symptom checkers, which can flow into telemedicine if you need. And then if you do need to see a clinician, house calls are actually preferred to actually going into the clinic. And then obviously being able to go to the clinic as a last resort as needed. And so what we've been able to do is to support these interactions with specialty expertise. So when you see that patient and triage them, whether it's via telemedicine, house call, or in-person visit, you can get an opinion from a specialist very quickly and be able to act on that for the patient. So as I mentioned, the structure that we've enabled has allowed for a very fast initial response. We've obviously seen, as one would expect, a spike in cases tied to COVID, related to COVID-19. And so we've been able to help with triage and treatment. We've been able to support virtual care across all specialties. So we help to expand capacity in the system. So things that were going into the clinic can now be handled virtually. And then we help to provide support for patients going back to the clinic. We included a few examples of questions that we've seen here on the right. And these are just an example of how we can help to enable reactions across a number of different areas within this pandemic, excuse me. And finally here on our traction, So I mentioned this a little bit earlier, but we're a 6.5-year-old organization. So we're based in New York. We have a handful of people on the West Coast, but primarily our company, our operations are in New York. We're a venture-backed business. We've grown and built the organization by really partnering with primary care clinicians. We started very small, supporting small, what we call direct primary care practices across the country. And we're able to meet their needs. Direct primary care is membership-based primary care. And then we expanded from there, and we expanded to employer on-site clinics. So supporting large employers that had facilities on or near site for their employees. And then from there, we expanded, and we actually somewhat, I would almost say, stumbled into this market. But we were down meeting with on-site clinics in Nashville, and we found an on-site clinic for correctional health, so state prisons. And we had a great meeting, and it turns out that that was a huge need for them, and we were able to roll out there. That first group that we rolled out with, we ended up rolling out across the country with them in 8 states. And the initial champion is actually now one of our advisors who works directly with us. And I was catching up with him just yesterday. And so we support correctional health across 10 states now at the state prison level. We then expanded from there to value-based care. So we support value-based primary care organizations in both Medicaid and Medicare, and then to community health systems. So about half of what we support are Medicaid populations who lack access to appropriate expertise, a lot through rural parts of California, and then Central Texas have been really large pockets for us. And then we also support home health initiatives and health plans. So home health obviously is a great way to go to the patient, and we allow them to do more when they get there. And then health plans, we have a number of strategic partnerships with 4 of the top 5 health plans in the country, 5 of the top 10 plans. And so that's a little bit about our traction, how we've gotten to where we are today. We currently have about 5,000 clinicians across the country supporting or on our platform, primary care clinicians. So I'll stop there. I've included my email here. And so I want to say first of all, thank you. And then happy to take any questions on our model, how it works, and anything about our business.
Thank you very much, Gil. What a wonderful presentation. And I really noticed that Alaska's not on there. So I would love to get Alaska included in your map. I'd like to open it up.
You can see Hawaii is though. So
yeah, I can see that. So I'd like to open it up. I see that there's a question in the chat from Kai. Kai, do you want to unmute and maybe ask that live?
Sure, thanks. I really appreciate the presentation. Thank you for organizing this and for the presentation. The question I've got, I guess, is I'll just throw 2 at you. One is how, given the fact that the specialists are generally already very busy, how are you finding and attracting specialists to participate on this platform? And is that a challenge, or is that actually turning out to be easy? The other question I had is, I'm really interested in the notion of increasing people's access to healthcare. And I'm wondering, do you have to be somehow an accredited clinician or primary care physician to be able to use a platform like this? Or do you see the ability down the road to open it up to potentially lay people or some sort of healthcare navigator type of role that maybe takes the load off of primary care physicians in the future? Thanks for your comments on both.
Yeah, great question. Let me first start with the first question you asked. So I hesitate to say this because it sounds odd, but it's actually been, in terms of the challenges in growing this business over the last almost 7 years, getting specialists to do this hasn't actually been a real challenge. So there are a few reasons why. First, it scales really well. So we're supported by less than 300 specialists for 5,000 primary care clinicians. And the reason being is that a primary care clinician may have one question for a rheumatologist every few weeks, maybe once a month. And a rheumatologist on our platform can do 5+ consults a day. And so just by virtue of that discrepancy, one rheumatologist can handle the volume for a lot of primary care clinicians. So it hasn't been hard from a ratio perspective. The other thing is that the clinicians really do love this interaction. When you think about the way a doctor is trained, they basically are tested for about 10 years in order to become a board certified clinician. And so this is a little bit like that quizzing mechanism. So I think it plays to doctors like slight type A personality to some extent. And so I think that we found in the feedback has been that they really enjoy the interaction. The third reason is that they know they're helping. So this is one of the easiest ways as a well-trained clinician to scale your impact. So you can answer questions and know that you're providing your expertise very quickly. We've heard from a lot of the clinicians that we work with in the specialist side that when they're in the hospital, they're fighting to code, to get reimbursement, to put in things for their patients. And so there are a lot of barriers to just delivering care. When they get on our platform, they're just providing their expertise. It's a very direct and clear way to have impact. And then I'd be remiss if I didn't mention the real reason, which is they do get paid and remunerated for their expertise. So they are paid for their time that they provide on the platform. And then on the second question, I've gone so far down this rabbit hole that I have to back up. And if you wouldn't mind reminding me what the second question was.
Well, briefly, and I know there's going to be other questions that I want to give other people a chance, but the second question had to do with, is there a pathway for providing non-credentialed health providers to use something like this that could take load off of the credentialed providers?
Yep. So we've received, as you would expect, an influx over the last few weeks. And so we are exploring different use cases. So we do offer mid-level, so nurse practitioners and physician assistants. I believe we will over time evolve to provide, and we were just having a conversation right before the group joined. I think we will evolve over time to provide this to community health workers and others who would be kind of first responders or folks that are seeing patients in different ways. So I do think, and we've seen it in different settings. So in certain ways, a licensed clinical social worker is providing that primary outreach for a behavioral health patient. And so in settings like that, I think we would. So we don't today, but I believe that that's probably where we're going to be going in the very near future.
Well, Gil, we're very close to being almost at the end of your presentation. I'm going to let the community ask one more. Of course, they have your email and will forward any other further questions. But prior to letting one more question come on, I want to see what we can do for you. So what, as Alaskans, can we do to assist you in your business so that it is offered here?
Well, so we'd love to get to Alaska. We think that, first and foremost, there's a huge need and opportunity to serve the population there. I think what we need is, so the way our model works is that somebody is on the hook for the cost of specialty care, and we help to save that. And that is often the plan. Sometimes it's a government entity, and sometimes it's the physician practice. And so access and interactions with the plans that support the populations in Alaska would be great. And I think that's one way that can help us get out there. And then being able to offer this out to clinicians, this is first and foremost a tool to help get access to specialty expertise. So folks who are interested, we'd love to have them. And we are also offering free access around COVID-19 questions. And so anybody that would believe that they might be seeing those patients, we're happy to enable accounts for those folks. So my email is just gil@RubiconMD.com. So anybody in any of those categories, we'd love to chat.
Okay, fantastic. And we did have a couple of follow-up questions. One was, are you a competitor to a teledoc service, or do you incorporate a teledoc service into what you're doing?
So I'll try to answer quickly so that we can get to a few questions. So no, we're not a competitor. We know them really well and actually share an investor. So no, we're not a competitor to a teledoc. Teledoc's primary services are patient facing. They don't do a clinician to clinician interaction. So we're actually complementary to what they do.
Okay, awesome. Well, thank you. All right, we have time for one more question. Is there one more question that wants to be asked?
I'll ask one pretty quick if that's okay, Jacqueline.
Sure.
Hi, Gil, this is Nigel Sharp. I guess I'm really interested in sort of more the business strategy piece of never letting a crisis go to waste. And right now we've got a crisis. So how does that affect, I mean, you obviously brought a lot of the COVID-19 into your slides today and talked a bit about that, but in a sort of more macro strategic view of your business, how do you use that to leverage that to grow a business right now? And kind of like, the advice you would give to other entrepreneurs or other people pursuing things in the sector to really sort of leverage, the current crisis to bring honed focus into the healthcare innovation sort of space.
Yeah, well, what I would say is I think the space of virtual care has moved forward about 25 years in the span of 2 weeks. So it's the right place to be right now. I think so there are a few things that I would say broadly that are also specific to our business. So first and foremost, I think being a good corporate citizen will pay dividends in this time. And I think that's true for us and for everybody. But going and providing support for the need will be like a very, very strong business driver or business growth driver over time. So I think there are probably two things. So one, the system needs a ton more capacity virtually. So that's what we help to enable. So anything that's not COVID-19 related, we're here in New York City, which is, apparently now the epicenter. We took that title from Seattle. So anything that's not COVID-19 related needs to go virtually. And so moving that care out of the hospital, if you enable that in any way, you're part of the solution. And a lot of things need to be stitched together to create a solution. So home visits or something, and we support that. And so we have to stitch ourselves together. And then the other piece is for anybody triaging COVID-19, there are a lot of clinicians who are getting up to speed on regulations and rules and treatment guidelines that are changing hourly, daily, almost by the minute. And so if you can provide any expertise to help those folks treating and triaging, and obviously anybody that can help get testing equipment, those pieces out to them, it's a huge bet. But we support the first two I mentioned. We offer capacity to do things virtually. And so we're just basically enabling access to people. And we're not worried too much about, we still do have to cover costs, but right now it's a crisis. And so if you can get this tool into the hands of people and they can use it, we found that over time, it's very sticky, and that'll make business sense eventually for us.
What an awesome answer, Gil. Thank you so much. And thank you very much for presenting today. It's been absolutely delightful. What I'd like to do is follow up with you and your team after this and see what I like to do is just make all those really important connections. And typically people will follow up with questions and ideas, and I'll just make sure that all of those go to you. And I'll keep checking in. I'd like to hear more about how you're doing in the next few weeks and months. And thank you again for your time.
Thank you, guys. Really appreciate the opportunity. Hope everybody stays safe, and we'll look forward to hopefully bringing this to Alaska in the very near future. Thank you, guys.
Thank you, Gil.
Take care.
Thank you so much.
Okay.
Of course, thank you.
Thank you, Elta.
Okay. Thank you.
Bye-bye.
Goodbye.